topics. So today's video we'll be discussing about the physiological and anatomical changes, and within it the most important is the what can be I'm going to discuss is the alimentary canal changes during pregnancy. So what happens is during pregnancy, the most of the women, what they complain that their gums become spongy just because of there is an intracellular fluid retention, and which is possibly a progesterone effect. It can also be seen that the alimentary canal changes, what is mostly seen that the lower esophageal sphincter is relaxed, so leading to the regurgitation of the gastric contents, and possibly the women mostly complains of heartburn. Gastric secretion is decreased and food remains longer in the stomach. Now, when it comes to the intestinal musculature, so intestinal musculature is relaxed with lower motility, and since there's intestinal musculature is relaxed, the motility is lower, so there is better absorption of greater absorption of the nutrients. But one of the possible side effects, the drawback of it, is that it can lead to constipation. So this is a very important in the physiological and the anatomical changes. When it comes to writing about the alimentary canal changes during pregnancy, this is a very important consideration, that what all things can happen and what are the possible outcomes of such things. So as I've already discussed, most of the women, they complain of spongy gums just because of the fluid retention, which is possibly a progesterone effect. Later on, that the lower esophageal sphincter is so much relaxed that most of the women, they complain of heartburn, and there is regurgitation of the gastric contents. It can also be seen when it comes to the lower alimentary canal, that is in the intestines. In the intestine, it can be seen that the motility of the intestinal musculature is reduced, which can lead to better absorption of nutrients. So this can be the possible outcome for the weight gain during pregnancy. So there is better absorption of nutrients because of the decreased motility of the intestinal musculature, but this is also a drawback, that most of the women, they complain of constipation during pregnancy. So students and viewers, this was a very short discussion where I have discussed about the physiological and the anatomical changes during pregnancy, in which we have discussed about the alimentary canal changes. In the upcoming videos, we'll be discussing about the immune system response during pregnancy. So students and viewers, if you like this video, give this video a thumbs up. If you are new to this channel, if you haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for the upcoming videos. Thank you for watching.